Have you ever suddenly realized your legs suddenly become heavy, weak, without understanding why? A silent disease, a hidden enemy, every day, every hour, taking away that precious strength. That is diabetes. Without warning, no obvious pain, but silently destroying every blood vessel, every nerve, making our legs weaker, little by little, little by little, much more dangerous than we think. Have you ever experienced that feeling? Share your feelings in the comments section, because maybe many other people are also experiencing this silent worry. And don't forget to click the subscribe button to join me in learning how to protect your feet and your precious health. Have you ever suddenly realized your legs suddenly become heavy, weak, without understanding why? A silent disease, a hidden enemy, every day, every hour, taking away that precious strength. That is diabetes. Without warning, no obvious pain, but silently destroying every blood vessel, every nerve, making our legs weaker, little by little, little by little, much more dangerous than we think. Have you ever experienced that feeling? Share your feelings in the comments section, because maybe many other people are also experiencing this silent worry. And don't forget to click the subscribe button to join me in learning how to protect your feet and your precious health. To understand, we need to go deeper into the body. When blood sugar levels are constantly high, it will silently destroy the small blood vessels that nourish the feet and legs. The nerves, which are responsible for sensing pain, heat, and cold, are also severely damaged. As a result, small wounds that normally heal quickly now become infected, deep ulcers, and are difficult to heal. Even many people no longer feel the pain to know they are injured. That is the reason why diabetes silently robs the patient of strength, and sometimes even the patient's own legs. So specifically, how is the body destroyed in each stage? Let's explore with me right after this. Diabetes is not simply high blood sugar. Behind that number is a silent process of destruction inside our bodies. When high blood sugar persists, the small blood vessels, as thin as hair, are damaged first. These blood vessels are responsible for carrying nutrients and oxygen to the feet. But under the continuous impact of high blood sugar, the vessel walls gradually become thicker, more sclerotic. Blood circulation is obstructed. Muscle tissues, nerve tissues, begin to lack oxygen, lack nutrients. Slowly, the cells in the feet begin to weaken and die in small pieces. At the same time, the peripheral nerves are also severely damaged. High blood sugar damages the protective layer of the nerves, causing inflammation, destroying the ability to transmit nerve signals. First, the patient only feels slight tingling, then gradually is the feeling of numbness, loss of hot and cold sensation, loss of the ability to perceive pain. When the foot is scratched, crushed, burned, the patient does not feel the danger that is silently happening. Small wounds, due to lack of blood supply, cannot heal. Infection appears deep into the tissues, spreading throughout the foot. Finally, when it is too severe, there is no other way but to amputate to save the patient's life. That is the silent path that diabetes is quietly eroding each foot, each life. From the silent injuries in the body, the first signs begin to appear. First, the patient feels a slight numbness in the toes, like ants crawling, or like being pricked by a needle. Sometimes, there are dull aches, or a burning sensation, like standing on hot coals, even though the feet are still cold. These symptoms are initially very mild, making many people subjective thinking it is just due to fatigue or age. But over time, the nerve damage becomes more and more severe. The patient begins to gradually lose the ability to feel. The coldness of the ground, the burning heat of boiling water, or even the pain warning of the wound, all fade or disappear completely. When the feet lose feeling, the patient no longer realizes that he is injured. A small pebble in the shoe, a blister caused by shoe rubbing, or a burn from stepping on a hot floor, all can turn into open wounds, but the patient is unaware, because they no longer feel pain to warn them. That small wound, because of lack of blood supply, cannot heal. The infection begins to creep in silently, deep into the soft tissue, then spreads to the bone. The ulcers grow larger, spreading to the feet, ankles, even the calves. Meanwhile, the patient is still walking, still doing normal activities, because they no longer feel pain. When the wound swells, oozes, the disease has entered the stage of severe necrosis. At that time, keeping the legs is almost impossible, and the most heartbreaking consequence is having to amputate the joint, amputate the foot, to prevent the infection from spreading throughout the body. Imagine, your feet are like a lush green garden. That garden needs an abundant source of water from tiny bloodstreams to sustain life. But when the blood circulation is blocked, when that source of water gradually dries up, the plants in the garden begin to wither, dry up, and then die. Our feet are the same. When the blood is not enough to nourish, when the nerves are destroyed, the cells in the feet also gradually wither and die silently. And one day, just a small scratch can become an irreparable wound. The patient easily stumbles, ulcers appear, and if not cared for promptly, they will face the risk of losing their legs forever. If you really want to protect your feet, listen to your body, even the smallest changes. Here are early warning signs you absolutely should not ignore. Numbness in the toes, fingers. You may feel like ants crawling, or like a light prick in the tips of your fingers. First, it's just a passing feeling, but over time, this feeling will spread more, last longer, and it signals that nerve damage is starting. Loss of sensation of heat or cold. When your feet touch cold water or a hot floor, you can barely feel it clearly. This is a sign that the sensory nervous system has seriously deteriorated. And the danger is, when there is a minor burn or injury, you will not even know it. Pain when resting, even if you don't exercise. You still feel aching. Dull pain in your feet, ankles, calves. These pains are often more obvious at night, a sign that nerve tissue and blood vessels are being damaged and lacking oxygen. Losing balance when walking. You will feel difficulty keeping your balance when walking. Easy to stumble, easy to slip, even though the road is completely flat. Because when the sensory nerves are damaged, the body can no longer control the rhythmic steps as before. A small wound that does not heal, a scratch, a callus, seemingly harmless, but it lasts for weeks, months, and cannot be closed. This is the alarm bell that the blood is no longer circulating well to nourish the feet, and that wound can turn into an ulcer, risk of gangrene, if not treated promptly. If you or your loved ones are experiencing any of these signs, please do not ignore them. One simple action today could save your legs in the future. The initial signs are small, but if we are subjective, if we ignore them, they will silently progress into complications that are many times more dangerous. Diabetes is not just numbness or pain, but it can also take away our freedom, health, and even our legs. Right now, let's explore with me the most serious complications that diabetes can cause, and the reason why a small ulcer can also be exchanged for a lifetime in a wheelchair. First, the ulcer becomes infected. Bacteria eat deep into the skin, then spread to the soft tissue, bones, and even blood. The body at this time, because of poor blood circulation, because of a weakened immune system, cannot resist that invasion. If not controlled, the wound will turn into necrosis. Each piece of tissue in the foot will die, become black, smelly, and at that point, the doctor is forced to make the most painful decision, which is to amputate part or the entire foot to save the patient's life. According to the World Health Organization, WHO, every 20 seconds, a person with diabetes in the world is forced to amputate a limb due to complications of foot ulcers. A cold number, but reflects a heartbreaking reality that we cannot ignore. And remember, just a small ulcer, if you are subjective, can be exchanged for the rest of your life, attached to a wheelchair. A price too high, just because of initial indifference. The complications caused by diabetes are truly devastating, but the good news is we can completely prevent if we know how to take care of them properly and take the initiative to prevent them early. Our feet do not deserve to suffer such heavy losses just because of indifference or subjectivity. And right now, I will share with you simple measures, but extremely effective, help protect your feet from diabetic complications so you can still walk steadily and enjoy life to the fullest. First, tightly control blood sugar, because the higher the blood sugar level, the faster the nerves and blood vessels in the feet are damaged. Take your medication regularly as directed by your doctor. Never stop taking your medication or change the dosage on your own. Along with that, follow a scientific diet. Limit foods high in sugar and starch. Eat lots of green vegetables and fiber. Prioritize foods rich in omega-3 such as salmon, chia seeds, to protect blood vessels. Keeping blood sugar stable is the golden key to protect your feet. Next, take care of your feet every day. Take a few minutes every night. Observe the soles of your feet between your toes. Look for scratches, redness, blisters, or any unusual signs. If you find a wound, even a very small one, you need to treat it immediately or see a specialist. When washing your feet, use lukewarm water, not too hot, to avoid burns that you can't feel. After washing, dry gently, especially between your toes, because moisture can easily cause fungus and bacteria to grow. Apply a light layer of moisturizer. Keeps skin soft, avoids cracking, reduces the risk of injury. About shoes. Choose shoes that are soft and fit your feet. Shoes that are too tight will squeeze your toes, making them more susceptible to injury. Shoes that are too loose will cause your feet to slip, blister, and lose balance. Important note, never go barefoot even indoors, because just a small grain of sand or a sharp table corner can also cause an injury that you don't realize. Finally, maintain a gentle exercise routine every day. A short walk, 15 to 30 minutes a day, not only helps increase blood circulation to your feet, but also helps your body control blood sugar better. If you can't walk much, you can do gentle exercises on the spot. Stretch your feet and ankles. Rotate your ankles. Lift your heels up and down while sitting. These small movements will help improve blood circulation, nourish the tissues in your feet better, and slow down nerve damage. Just keep doing them every day. These small actions will become a strong shield, helping you protect your feet and keep you steady every step of your life. You see, these precious feet deserve our care and protection every day. The journey to stay healthy always starts with small steps, but persistently and full of love. Thank you for taking the time to accompany me until now. I wish you always healthy, always steady on every step, and always full of joy in every new day. Hello, and see you again in the next videos.